everyone, welcome to episode 14 of BCG's Health Tech Videos. I am Ariel Rothman, and today's moderator is Michael Ringel, Managing Director and Senior Partner at BCG. We have two panelists here today to discuss longevity. Alex Zhavoronkov is the founder and CEO of Insilico Medicine. He is also the founder and co-chair of the Aging Research and Drug Discovery Conference. Andrew Scott is the author of global best-selling books, The 100-Year Life and The Longevity Imperative. He is also co-founder of the Longevity Forum and professor of economics at the London Business School. Obviously, two incredible people to have here for this discussion topic. Thank you so much for joining. Now I'll pass it off to Michael to begin the discussion.
Yeah, thanks, Ariel, and thanks to both of you, Professor Scott and Dr. Zhavoronkov, for joining. So we'll try to keep this pretty relaxed, but it's a super interesting topic that is really emerging, and so we have a chance to shape it. And so we'd love to get your insight on how do we take this field and push it forward, because there's so much value for humanity here, which I'm sure we'll get into as we get into it. But there's some barriers that we need to overcome, and so your insight on how to do that is super helpful. So maybe I'll actually start with the first, which is around reimbursement and how we pay for this in the near term. There's a lot of long-term benefit, but of course there's upfront investment. So if you think about longevity, both health span and lifespan, you could imagine repairing damage after it occurs, but it's probably easier to prevent it. An ounce of prevention is worth a pound of cure, right? And so ideally, we're giving preventative therapies that keep us from getting these chronic diseases that ultimately drive the burden of morbidity and mortality, maybe even before we're symptomatic. Now that is not in the current paradigm of reimbursement, and so there's a hurdle there. And I'd like to talk about, well, how do we get over that hurdle if there is actually net present value of upfront prevention to prevent a lot of downstream cost? How do we get that through the health system? And maybe I'll turn over to you, Professor Scott, to start us off on that.
Yeah, I love the way you start, not with can we do it, but how do we pay for it, which I think is a great place to begin. So yeah, and I think we can do this in the short run and in the long run. I mean, we just need to embed preventative health more into our system, and it's going to vary how we do it. I'm kind of excited in the UK at the moment, where of course we have a government who's a single payer, but I think it's beginning to recognise we've got a lot of people off work who are ill, and if we can keep them in work, then it pays for itself. And the work I've been doing says this stuff actually pays off pretty quickly if you target certain types of people. So I'm actually optimistic we'll start to see a shift in the short run. Longer run, though, we've got a challenge because we pay a lot for intervention, and we've got to also then pay alongside it for prevention. So I think, how do we finance this new system? I think we're going to have to look to life insurance companies as major providers, either sort of purchasing health bonds where the return to the bondholder depends upon targeting certain biomarkers, or through offering policyholders, hey, if you take these treatments, I know you're going to live for longer, and it's good for me and it's good for you. So I think we'll start to see a bit more of a convergence between health and wealth. I also think we need basically some more incentives in drug development, because from an economic point of view, I know health is the most valuable thing in its own right. But with an aging population, we're going to see health have first-order impacts on GDP. And I think making sure we target drugs that don't just give us time at the end of life, but healthier years when we can be productive, is utterly key. And I think that's going to be quite a reworking of the tools and techniques that we have.
That's great. I love the point around building a coalition of those whose economic interests are aligned to it. Maybe Dr. Zhavoronkov, I'd love to hear your thoughts on the same question.
So sure. My problem with longevity in general, and I guess it's not only my problem, is that there is abundance of diagnostic solutions that actually work, and we can now track aging reasonably effectively and even help us prevent certain age-related diseases. However, there are very few effective therapeutic solutions. that provide us with significant longevity benefit and tangibly and demonstratively prevent disease and prevent certain aging processes. So currently, we just need to accelerate drug discovery in a very dramatic way and get more drugs on the market to have more shots on goal for possible longevity interventions. And the current reimbursement scheme, in my opinion, is actually very well tailored already. We don't need to classify aging as a disease to be able to get the drug approved. And usually, if the drug works on aging, it should work on a variety of diseases. So it would not be possible to find a drug that is powerful enough to modulate a specific type of aging biology, and it would not work in some disease. I wouldn't imagine that happening. And that's why it's very important to identify dual purpose therapeutics. That's what I'm doing quite at scale now, utilizing different types of aging biology to understand where basic biology, normal biology breaks, what is driving it, and how can we intervene. And we're looking for biological targets that are present in multiple biological mechanisms driving aging and disease at the same time, and then choosing a few of those to develop interventions.
Yeah, it's great. It's actually a very complimentary answer, right? If we're thinking about how we bolster, work on prevention, on health span, on lifespan, there's the demand side. How do we actually make it reimbursable and that there's a financial, return for those that invest in it. And there's also, I think, as you just pointed out, Dr. Zhavoronkov, there's the supply side. How do we lower the barrier to entry for companies to get into this? Super. Okay. Why don't we move on to the second question, which is a little bit of an orthogonal field, but maybe also a way to kind of start entry. So we've been focusing on therapeutics, but there's a very adjacent field of aesthetics, and there's a blurry line between them with medical aesthetics as well. This is an area where actually people are more willing to self-pay, and there are certainly emerging solutions that are not just they're not just visual. They're actually driving some underlying biology that is altering the amount of, let's say, aging that someone's undergoing. Is this an alternative way for us to get started? I mean, what do you think about the aesthetics field as an entry point?
As we see with a lot of obesity, anti-obesity drugs, people are willing to pay whatever it takes, even in countries that do not reimburse those drugs. And the supply is cannot keep up with demand. The next big wave that we see is going to be in muscle wasting. So now, we see as a side effect of some of those anti-obesity medications, people are losing muscle. That's also not exactly aesthetically attractive. And now many pharmaceutical companies are going after muscle loss as the possible or potential blockbuster therapeutic area. We are doing a lot of work for multiple pharmaceutical companies doing target discovery in this area. It's not easy. That biology is very, very difficult. But I think that this could be a major driving force behind additional innovations. And it's not only about, again, feeling better, it's about looking better. And I think that vanity is going to drive a lot of biomedical innovation, especially now that there are demonstrable, clinically proven effects. Previously, nothing really worked, and with GLP-1 inhibitors and multi-targeting agents that are targeting GLP-1, we see very substantial effects, and people really want it. They're willing to pay for it.
It's a really interesting question, and got me thinking, because we already know at the moment, I said earlier that we spend a lot of money on end-of-life drugs, which always seems a little bit out of proportion with the health benefits, although I think paying for hope is incredibly important, which is part of what people do. But we know there's a tendency to underinvest individually and socially in preventative health. So can you use that focus on aesthetics to try and prize open a bigger market? And I think that's right. I mean, we know that getting to change people's behavior because it's the right thing to do on its own is very difficult. I don't think we should underestimate the role of public health and education. And if you look at the way we drink less and smoke less over time, that's a combination of tax policies and education which have been successful. But my goodness, look at the response to the GLP-1 drugs. And I think what's really interesting about them is, as you were saying, the sort of overlap with some of these aging issues. But I think it also starts to shift things away from the disease perspective. And that's what's really interesting about them, because, what is prevention? It's not just about one disease. It's targeting some form of biomarker that affects your health by postponing multiple diseases. And I do think that's the beginning of change in terms of this radical interest in GLP-1, which comes to some extent from aesthetics, but then helps you sort of translate it into health. And my attitude in all these things, I would say I'm a patient optimist. I think change happens slowly. We're probably going to be behind where we'd like to be. But I do think this aesthetics and general wellness is going to be a great way into this this challenge.
Yeah, I will echo what you said after the first question, which is I loved your hopeful tone. There's so much value here, and so I like the positive attitude that will be able to unlock it. Last question, and maybe this will be a little bit of a macroeconomy, microeconomy question, which is, the incentives don't seem to be aligned for both health systems at the macro level to push this, and at the individual pharmaceutical company at the micro level. And is there an interface between those two that we think is interesting? Are those two separate questions, or can they be tackled together?
Yeah, and I agree. The system just isn't aligned, but it's not surprising, is it? I mean, to me, the most radical thing that's happened is that now we live in a world, particularly, global life expectancy is over 70. And in the high-income countries, the estimates are that 50% of children born today will live into their 90s at least. And I think that's probably conservative. And that's never been the case before. We frame this as an aging society, that there's lots of older people, but the real change now is the young and middle age can expect to become old. In my book, The Longevity Imperative, I say, an aging society begins when you've got lots of people aged over 65. A longevity society begins when you have people who will live to be over 65. And quite frankly, we underestimate the capacity of older people in our later years. We haven't created institutions to support a life this long, and we need to adapt and adjust. So the system is not working. We've got long lives. They're not yet healthy for long enough. They're not productive and engaged for long enough. So it's a pretty big change that needs to occur. But all of these things are possible. In the 20th century, we created teenagers, retirement, middle age, weekends. We can do the same again, but it's going to require changes in individual behavior, social norms, firms and the products they provide, the career opportunities they offer, as well as government. So, just a few things on sort of how I think we get the system aligned. For me, I think ministries of finance need to start thinking and making the retirement age a function of healthy life expectancy. It is crazy that health is nowhere in the system a major incentive. And we know we've got long lives. Making them healthy for longer is absolutely a stunning priority, not just for the economy, but for our individual welfare. Health is incredibly important, as Alex was saying. So let's have ministries of finance with an incentive to achieve good health outcomes, because it will then support people working for longer, which brings in the tax revenue to pay for all the things we need to do with an aging society. But really embed healthy life expectancy as a target. For firms, I think we misread this. We always talk about a silver economy and all these people aged over 65, and that invariably ends up talking about cruise ships and care homes and adult diapers. I say, we need to have an evergreen economy. We have to have the products that help us keep fit, healthy, engaged, and skillful for longer. And that's the finance sector, that's the education sector, food and beverages, the pharma sector. But this is an enormous opportunity because health is so important to us. And as how we age is now the most important priority, it's an enormous market. I would say I will be prepared to pay to be looked after if I get dementia. I'll spend a fortune to avoid getting dementia. But to do this, we've got to change our mindset away from, there's all these old people, and underestimating their capacity, to say, wow, a second longevity revolution begins. the first one is over, the majority can now expect to become old. Now we have to focus on changing how we age, and nothing is more important than that.
That's great. So yeah, super compelling vision. I love how both of you focused on ultimately the importance of policymakers. I would reflect that policymakers in the end are also ultimately influenced by the will of the people and what people pay attention to, which is why webcasts like this one are so important, because getting the message out from such knowledgeable individuals as yourself is exactly how we build that coalition. So thank you both for your time, your insight, your engagement, and really appreciate it